we have next our other student presenter, and not only was it a happy coincidence that one of the contest winners was named Ted, it's also a happy coincidence that the other student contest winner is named Bill. Bill? Okay. Anyway, next, without further ado, we're going to hear from Bill Fuller.
Chris Rogg always makes this look so easy. Good afternoon. For those of you whom I've not yet had the pleasure to meet, my name is Bill Fuller. I'm a third-year medical student at SUNY Downstate. The title of my talk today, How Can We Help Make Students into Great Doctors, is a great question. It's full of noble purpose, and I'm in fact so fond of it that I wish I could tell you it was the question I had set out to answer. But the actual problem that I considered when first conceiving this talk for today is slightly different, and in the interest of creating some context, I feel I should tell you about it. It is a consensus among med students that some parts of med school suck. Now, many of you will be quick to point out that it is also a consensus among every member of every profession that some parts of their jobs suck too, and that's a fair point. But let us consider for a moment that med students are largely young men and women, ostensibly doing our dream jobs in the formative years of becoming professionals at the art of caring for others. And let us ask ourselves, why are these people unhappy in their work? And what does it imply for the doctors they'll grow up to be? So I hope I have made my case for being taken seriously, in spite of the fact that I originally intended to entitle this presentation, Why Med School Sucks Sometimes and How We Can Fix It. If you work with med students, you may be excused for being very tired of hearing about this problem. If you don't work with us, you may never have heard about the problem at all. And regardless, as it is not incredibly sympathetic for us to complain, given our virtually guaranteed entry into a respectable and reliably employed field, I could even understand it if you didn't think you cared. But you should care. And it has to do with the problem with which we're all a little bit more familiar. We all know a guy at work who just does not want to be there. Every task is an annoyance bordering on persecution, and every coworker and client is a demon spawned specifically to torment this man. It's generally not the guy you go to if you want an important task done well. When that guy is a doctor, we have a problem. That problem is called burnout. Burnout is a mental state characterized by cynicism, depersonalization, and emotional exhaustion. A 2012 study published in the Archives of Internal Medicine found that physicians self-reported a 37.9% rate of burnout, compared with 27.8% in the general population. Now, 27.8 still sounds ridiculous, as it means if you get 4 coworkers in a room, one of them probably hates the other 3. But nonetheless, there's a clear and, in fact, statistically significant increase in burnout risk among physicians. Now, there's already been a long conversation about why burnout happens and why it affects so many members of our population, because when you're talking about a population, a profession that's supposed to be empathetic, open, and non-judgmental, words like cynicism and depersonalization are ones we would like to avoid. But what I'm here to talk about today is the fact that this starts earlier than we traditionally think that it does. It starts right as we make our way onto the wards for the beginning of our clinical rotations, traditionally during the third year of medical school. Now, I emphasize the third year of medical school because the first 2 years are the sit-in-the-classroom part of med school. And anyone who figures out how to make sitting in lecture for days and months on end a more pleasant experience will probably need more than 10 minutes to tell you about it. But a lot of institutions, including notably my own home institution of SUNY Downstate, are combating this problem by attempting to front-load the patient care aspect of medical education, effectively making earlier the aspects of medical education that seem exciting and meaningful in dealing with patients. It's the fact that even these aspects can leave some medical students feeling quite frankly burnt out that I wanted to talk about today. And I want to start by taking a look at what a to-do list looks like for a third-year med student, our first day on the wards. We want to help, and we want to learn something. And that's about all we know how to want to do. I mean, some of us may have had some other items on our personal to-do lists, but that's neither here nor there. The bottom line is, some of it is naivete. Some of it is we don't really know what this experience is supposed to be like, and so we don't know what we're supposed to want out of it. But a lot of it is genuine goodwill. Because we didn't go to school to become students. We came to become doctors. And this day, our first day in the clinic, is the closest we have ever been. We have been sitting for 2 years chomping at the bit to get out here. And it's the first taste we've really had of a life for which we've already sacrificed so much. You're working with people who are genuinely excited to come to work, which is a rare breed. And about a month later, that's pretty much worked itself out. Our new to-do list might look something like this. Don't get yelled at, obvious. Avoid rounds, which are very boring. Retract if you're on surgery, because someone has to. Obviously, you're going to take a 2-hour lunch, because you can, and you should try to leave early to study for the shelf, because why are you going to hang around the wards? Now, this is a caricature, to be sure. Don't think that medical students are all like this, though I think that every student in the room can think of one student who probably does think this way. That being said, there's more truth in it for each of us than we might like to admit to ourselves. I love medical school. It is the best thing I have ever done. And yet I catch myself thinking this way more often than I'd care to admit, thinking not how I can do well, but how I can get through. Thinking not about how I can help the next patient, but hoping that maybe they won't show up. It's shameful, and I am ashamed. But we do ourselves a disservice if we do not acknowledge these feelings. Now, why is this a problem? How do we become so cynical so quickly? Well, I had my suspicions that because all good medical students love data, I thought I would poll some members of my class. I polled about 30 people and picked my favorite responses, though they're all in the same vein. I hate being ignored. Nobody even cares if I'm there. We don't have enough real responsibility. And I just want someone to teach me something. Now, I want to notice something before I go any further, which is the fact that not a single person told me they were overworked. Not one person told me the exams were too stressful, and nobody even complained to me about the hours. Now, don't get me wrong, med students love to complain about the hours. As far as I can tell, it's our favorite topic of conversation. But when asked what the real problem is, what has made them at times resent their status as a clinical medical student, every single person I spoke to, no exceptions, mentioned a lack of meaningful work. Perhaps it's a trade secret among med students that we spend most of our day looking for something to do. On many services, our role is not well defined, and when we can't find a task even after we have awkwardly crawled to every member of the team and asked, "What can I do for you?" it can make us feel kind of worthless. And on the other side of the coin, everyone I spoke to could recall one rotation, one series of weeks in which they were worked to the bone, day and night, working on patients and constantly tasked with something. And they were the happiest they had been in medical school. You can see they have no problem remembering why they wanted to be doctors when they're talking about this time. So why can't we find meaningful work all the time? Well, to talk about that, I wanted to show you some more to-do lists. The doctors we work with most frequently are the residents, both the junior and senior residents. So what do their to-do lists look like? Well, an intern, a first-year resident, has to write orders, write discharge summaries, study for their in-service exam, which I'm told they have to pass, update the online dating profile, because OkCupid does not do it itself, and, maybe teach the medical student. How about the senior resident? They have to call consults, manage the interns, see lawyers about the patient whose life they sued and is saved and is now suing them, maybe see their wife who they haven't seen in 3 days because they've been on overnight call, and oh yes, teach the medical student. Or don't, and suffer no consequences. But I show you these priorities not to blame these people, but to absolve them. For when we're speaking of people of whom we already ask so much, days, nights, a life of sacrifice for people, can we really tell them they should stick around to teach us instead of going home and trying to have some life outside of work? I think not. They're only responding to incentives. But then what do? We change the incentives, and it's simpler than we think. Take us off the to-do list. Every intern worth a damn can think of something he can do to improve patient care if he only had 20 minutes. Guess what? We have the time. Send us to educate a patient about diabetes for 20 minutes when he just got diagnosed. Send us to talk to a woman about how her new cancer diagnosis is making her feel. Give us the tasks you don't even think about anymore because you haven't had the time to do them for your entire career. We have the time. We will go through a patient's prescriptions bottle by bottle with him until he understands why he's supposed to take them. We, in so doing, will understand what works and what doesn't when we talk to a patient about a care plan. We can do all of these things. We need not be a burden on your time. We can be a tool. We will write a note about a patient we've seen that is exhaustive and detailed, not because we're supposed to, but because in so doing, we will learn and reinforce for ourselves what the treatment of this patient's disease looks like. We have the time. And speaking of time, mine is up, but I'm going to go quickly. I hope you'll grant me another minute and a half, please. I'm so close. Regardless, I hope no one here ends up as a patient in the hospital, but if you or your family member does, don't kick the medical student out of the room, because if you want someone who will take the time to speak with you and understand your problem, you want a medical student. Use us. I'm not trying to absolve the students of our own responsibility for this, because indeed we are complicit in our own descent into apathy. So if this is something you're going to join me in asking of the physicians with whom we work, we have to be hungry for it. We have to hunt down productivity. And we have to never give in to the desire to want to do less. We have to never resent being given a task if that task is meaningful and we can learn from it. Do more work, do meaningful work, and you will be happy. One last thing, a thing I've learned from medical school is that no matter how well and how beautifully you speak, people are only going to remember about 3 things that you've said. And so as not to presume how the quality of my talk has been, I only want you to remember 1. Doctors and medical students aren't born burnt out. But many factors conspire to make us that way. And when we see a physician who appears apathetic, we should not blame him. We should instead look to change the incentives. For medical students, that means everyone, doctors, patients, and most importantly, the students ourselves, working hard to give us a real responsibility for patient care. Third-year med students are still idealistic, and we are hungry to have that idealism rewarded. Like everyone, everywhere, we want to do important work and feel that it has meaning. Turn us loose. Help us take ourselves off the to-do list. We'll thank you for it, and you will have better doctors for your trouble. Thank you. While I'm up here, I would also mention for those who have not already heard, I also have the pleasure of serving as the physician recruitment chair for the Brooklyn Free Clinic. Please come talk to me if you are a licensed physician in internal medicine or emergency medicine and you might have a Tuesday night free once in a while. We're doing great work and we need your help. Thank you.